Today we're going to be talking about neurogenic shock. This presentation was put together by Cordova, Higgins, Ratchkamake, and Schmidt. As we go through our presentation, we are going to be going over an introduction, so we'll be introducing what neurogenic shock is. We'll be going over pathophysiology, so what is going on inside of the body. EMS findings, so what we will see as EMS providers, this will be like our signs and symptoms. And then we will also be going over treatments. How can we treat neurogenic shock? Before we begin, I would like to introduce a case study that we'll be following throughout the presentation. So you receive a call for a 35-year-old male who was involved in a severe motor vehicle accident. At the time of the page, no other information was given. What are some things that you would want to think about on the way to this scene? So some things you might want to consider or think about would be any spinal injuries, injuries to the neck, any fractures, lacerations, and even potential internal bleeding. So we will now dive into our introduction of what is neurogenic shock. So neurogenic shock results from a combination of primary and secondary injuries to the spinal cord that cause a loss of response in the sympathetic and parasympathetic nervous systems. Now that can be a lot to digest, it's a big definition, but hopefully as we progress throughout this PowerPoint in this presentation, it will be more clear and you'll be able to understand what that means. And then just some quick statistics for you guys. 19 to 35% of people with spinal cord injuries also suffer from neurogenic shock. And then every year in America, up to 10,000 people sustain a spinal cord injury. So just be aware that these things do happen and that it is something that we want to be on the lookout for. Pathophysiology. What is happening inside of the body? So when neurogenic occurs, it occurs when there's an injury to the sympathetic and parasympathetic nervous systems. Generally, this is going to be from a combination of primary and secondary injuries. So a primary injury is going to be an injury that happens very quickly within minutes of the incident happening, and it is going to be direct damage to the axons and neural membranes. Secondary injuries often happen hours to days after an incident, and they are caused by vascular injuries such as a stroke or a CVA, electrolyte shifts, or edema at the injury site. So as EMS providers, it's probably more common that we'll be seeing neurogenic shock due to primary injuries, but we do need to be aware that it can happen with those secondary injuries such as stroke or CVA. It is something that we need to be aware of and keep an eye out for. As we continue, I just want to go over some quick anatomy for you guys. So, as you can see, we have the anatomy of a neuron. And so the neuron is going to produce an electrical impulse inside of the nucleus, which is going to be that darker red circle that you see in kind of the bigger part of the neuron. And it's going to go through the axon, which is going to be that middle part that you see is covered in those orange rectangles. Then the electrical impulse is going to go through those little structures at the end called the axon terminal, and they will then go to the next neuron. So what we are focusing on with neurogenic shock is going to be the axon part of the neuron. And this is a thin, hair-like part of a neuron that sends electrical impulses to other neurons. Damage to the axon prohibits communication between neurons. Axons are super important because they send messages from one neuron to the next, but how do they work? Axons are the passageway that neuropeptides use to get from one neuron to the next. So neuropeptides are going to be those electrical impulses that are generated within the nucleus. Neuropeptides are what carries the message. They trigger actions such as muscle contractions, but they also trigger actions that will affect your heart rate, blood pressure, respiratory rate, Pretty much anything that goes on inside of your body, neuropeptides trigger. One way that I like to think of an axon and a neuropeptide is I like to think of the axon as a mailman, meaning that a mailman carries messages from one place to the next, much like an axon does. And then I like to think of the neuropeptide as a piece of mail, meaning that mail, like a letter that you get in the mail, contains a message. And that's what a neuropeptide is. A neuropeptide is containing a message for the next neuron to read and then perform that action that is inside of that message. Catecholamines are a specific type of neurotransmitter that works to maintain homeostasis. So these are going to be part of our fight or flight response, meaning that they're very important when we are talking about neurogenic shock. So some examples of catecholamines that we are going to be dealing with often is going to be dopamine and norepinephrine. So these two catecholamines regulate blood pressure by contracting our vascular system. These are two catecholamines that we can manipulate in the body through the use of different medications, which we will discuss later as we discuss treatments. So just to go over all the information that we just talked about, so when neurogenic shock happens, axons are damaged, and then with that, neurotransmitters are unable to communicate. This lack of communication from damaged axons then will cause changes in the vascular system. So things such as our heart rate and blood pressure are going to be changed because of this lack of communication. Those changes in the vascular system then lead to poor tissue perfusion and poor cellular metabolism. And as we know, that's really important. Our tissues need to be getting an adequate amount of blood in order for our cells to thrive and survive. So our cells need that blood with the oxygen and the nutrients that our blood carries in order to perform their metabolic functions that keep us going. So it's very important. And then following through with our case studies. So upon arrival to our scene, we start asking our patient sample questions and going through our DCAT BTLS questions. Our patient is able to give his name and we know his age from dispatch, but he is unable to give us any other information. So with that, we suspect that he may have sustained neural damage. So what are your next steps going to be? Again, his name is Jimmy, so we know that. He's 35 years old. We know that he is male, but he is unable to give us any other information. He's confused, disorientated. So what should you be thinking about? You'd probably primarily be thinking some type of head or neck injury given the confusion. So what are we going to do next? And that's what we will discuss as we progress.
EMS findings. So this section is going to cover what we expect to see as EMS providers in the field when neurogenic shock is the primary cause. So the common findings we will see when we take our sets of vital signs are going to be hypotension. So we're going to see low blood pressures, 80/30. Just a generic example. We can see blood pressures a little bit better or significantly worse. Bradycardia, again, there's a disconnect with our receptors in our body trying to tell the brain to speed up, and they're not, so we will see a slower heart rate, and people will be breathing slower. They'll have a depressed respiratory function as well. And then when we're continuing on with our physical assessment of the patient, we're going to find warm, flushed skin, but as time goes on, especially in our rural areas, if you spend a significant amount of time with your patient during a transport, it is very likely that they will turn cold and clammy as the body begins to have that downward spiral effect. And our capillary refill will become slower, again, because of the low blood pressure, the slowing heart rate, the inadequate perfusion going throughout the body. The big thing is we need to be focusing on with our patient assessment is their alertness, because if they are going in and out of consciousness, that is going to push us to have to ask very important questions very quickly when we get on scene. I think as time goes on, we get more proficient with our patient assessments. But one thing I always think of, especially when I've dealt with patients in vehicle accidents, is to get the most pertinent information I can from them right away. So, do they have any allergies and are they taking any medications? Those two questions are probably two of the most important we can ask, especially if we're not sure if they're going to be altered in any way or if they're going to be dipping in and out of consciousness. The big thing as EMS providers we really need to focus on is not being caught up in the blood and guts. So, yes, somebody can be bleeding a lot, but we need to be calm and effective with our patient treatment and assessment. This means just because there's a large laceration on the patient, if we can control the bleeding, we need to move on. The patient may have suffered a severe accident and is focused on the fact that maybe their ulna is sticking up and out of their arm. Well, yes, that is bad, but if we can control it or there is obvious deformity, there's nothing we're going to do in the field that's going to fix that problem. We need to continue with our assessment and focus on the fact that this patient has some sort of spinal injury. The other side of this, again, is traumatic injury is not always the root. There are certain immune disorders and exposure to toxic chemicals that are more common in the workplace than you would think. Lots of factory and food processing jobs contain extremely harsh chemicals, and if they were to escape their container and workers were exposed to them, this can have severe neurological damage and effects to our patients. So again, knowing what's in your response area, knowing what kind of hazards you're going up against, either as just paramedics or fire medics, these are all important things to keep in mind when dealing with patients who are presenting in unusual ways. So again, just to recap our vital signs, we have our normal blood pressure and heart rate and respiratory rate that we all had pounded into us in EMT school. During our group research into neurogenic shock, these are some very common case by case vital signs that you can come across. And if you suspect some sort of neurological deficiency or there's a significant trauma to the patient's spinal cord, this is what you're seeing. We would push you to start going down neurogenic shock as the culprit. So the case study that we are following with good old Jimmy was having a really rough day. 35-year-old male, lives in Ohio. So if you're performing your vital signs, let's say you're on scene of a two-vehicle accident and you find Jimmy still in his car, wasn't wearing a seatbelt. You have spidering in the windshield and severe impact to the side of the car, more than a foot into the car. We're gonna, put in C-spine precautions, remove the patient as quickly and efficiently as we can while trying not to cause any more harm to Jimmy. You get in the back of the ambulance and you find blood pressures of 90/46, heart rate of 48, respiratory rate of 7, and patient's physical assessment is you have a gentleman with pink warm skin, clear lung sounds bilaterally, but there's tenderness on his neck and he is in a great deal of pain. Where would you go from here? Obviously, treat your patient. If there's a substantial bleed somewhere that you didn't initially see when he was in the car, we need to treat that on top of trying to go down the thought process of what is causing this low blood pressure and this low heart rate. This gentleman was just in a severe accident. He should be hyper. His heart rate should be, through the roof, depending on his physical ability and day-to-day activities, and his respiratory rate is 7. I don't know if everybody has dealt with somebody who was just in a major car accident. My experiences have been the child that I had was very, very frantic. He was hyperventilating. Obviously, he was only 12, so his heart rate is going to be higher naturally anyways. But if you're looking at Jimmy here, who's 35, and he has a heart rate of 48, well, he's not sleeping. He didn't just take a handful of melatonin. We know something is going on. Now, obviously, we would primarily think, well, maybe this is hypovolemia, but If there's no major blood bleeding seen and the patient was in maybe a less severe accident, we would start to think that perhaps neurogenic shock is the culprit.
In this section, we will be talking about treatments and what EMS providers can do. Looking at some first-line treatment options as an EMS provider that we can provide would be spinal immobilization, C-collar, IV fluids, which can help and replace body functions. A lot of times with neurogenic shock, we could be dealing with spinal injuries, and the last thing we want is to move a patient a certain way or cause more damage to the spine. Looking at what we can do with IV fluids. So the use of IV fluids can help replace and restore body functions. Vasopressors are a common type of medication given via IV to help. It provides vasoconstriction to make blood vessels smaller and increases blood pressure and increases heart rate. Because a lot of times with neurogenic shock, we're dealing with lower blood pressure, lower heart rate. It all is very effective. As discussed above in IV fluids, we talked about vasopressors. Common ones when dealing with neurogenic shock are going to be epinephrine, norepinephrine, and dopamine. Epinephrine is naturally released by adrenal glands in response to fight or flight. It can be used to induce fight or flight. Norepinephrine is naturally released by adrenal glands and raises blood pressure. And dopamine, naturally released to regulate blood pressure, treats low cardiac output and improves blood flow to the kidneys. So I'm going to go in more depth in the next following slides, just discussing these vasopressors a little bit better. So when we look at epinephrine, when we administer it, epinephrine or adrenaline to a patient, we expect alpha beta 1 and beta 2 agonist effects, which are increase in blood pressure, increase in heart rate, increased cardiac contractility, and dilation of the bronchioles in the lungs, as well as dilation of the vessels in the skeletal muscles. Norepinephrine. When we administer norepinephrine to a patient, we expect alpha beta 1 and beta 2 antagonist effects, which are increase in heart rate and blood pumping from the heart, increase blood pressure, and helps break down fat and increase blood sugar levels to provide more energy to the body. Dopamine. So when we administer dopamine to a patient, we expect alpha beta 1 and alpha beta 2 agonist effects as well. Which are naturally they are used to naturally release, regulate blood pressure, treat low cardiac output, improve blood flow to the kidneys, and just better perfusion all around in the body. So looking more in depth at our vasopressors, norepinephrine, epinephrine, and dopamine, they all have alpha beta 1 and beta 2 receptors, which make alpha antagonist. So beta 1 and beta 2 adrenergic receptors are a type of adrenergic receptor that plays a central role in the sympathetic nervous system, the part of the nervous system that increases heart rate, blood pressure, breathing rates, and eye pupil size. Norepinephrine, epinephrine, and dopamine are classified under catecholamine. So what does an alpha antagonist do? Alpha receptors are located in the smooth muscle as well as the arteries. Stimulation of these receptors results in vasoconstriction, increasing afterload, causing hypertension. Alpha agonists are used intravenously to increase afterload in the setting of shock. So, catecholamines class. As mentioned in previous slides, these medications are classified in catecholamines because they are physiologically important neurotransmitters that are part of the sympathetic and central nervous systems. Catecholamines act on both the alpha and beta adrenergic receptors. Catecholamines are released in times of stress. Let's say you have a 35-year-old male patient, and after assessing your patient and his vitals, you determine that he may be going into neurogenic shock. What type of medication would you administer, and how would you expect it to change the patient's condition? Post-EMS care, specialized care. Some hospitals have doctors and departments that specialize in neurological disorders and can do further testing such as brain scans. Continuous monitoring. Doctors at the hospital can provide continuous monitoring to the patient to ensure they are receiving the care they need. Continued use of vasopressors. Some doctors and other hospital staff can continue to administer vasopressors to help the body heal. over time. Thank you.
To conclude the presentation, we have a short video to watch, and then we're going to talk about the importance of recognizing neurogenic shock and proper treatment. So I tend to be more of a visual learner, and I'm assuming there's some people out there watching this that are as well. There's a very good video by Khan Academy that goes over what is happening in the body when neurogenic shock takes place. So I'm kind of going to replay some of the high points. That video is long. They don't show what the treatment looks like back into this diagram. So I'm going to go through that now so you can have a better understanding. So in this drawing you can see the brain up here on the left connected to the heart. This is the circulatory system going to the body tissues and coming back, so your arteries and your veins. If you could imagine that this is like a perfect system right now, homeostasis is being achieved, the heart rate is good, blood pressure is good, the body tissues are being properly perfused. So in the case of neurogenic shock, what happens is this link between the brain, the heart, the circulatory system, the body tissues, it's interrupted. That could be from a trauma, that could be from a degenerative disease, maybe some anesthetic issues, but the impulses from the body, from the heart, from the circulatory system, are not making it back to the brain, and in response, the brain's impulses back to the body to help compensate for any issues is interrupted as well. So what happens when this is the case is your heart rate returns to like a default. So your heart rate goes down. Your arteries and your veins also return to like a default state. So the vascular tone that's in your arteries relaxes. So your arteries become much larger than they already are. All that smooth muscle relaxes. Same thing happens to your veins. So what happens is the heart rate goes down, so you're already moving less oxygenated blood to your body tissues and less of that deoxygenated blood back to your heart just by terms of the pump moving slower. But then your vascular tone isn't proper. Your arteries are larger, they become more relaxed. Same thing with your veins, and that smaller amount of blood that would be maintained is kind of has a hard time getting over the edge and getting back to your body tissues. And similarly, the blood coming from your body tissues back to your heart kind of pools up in the low spots, and it doesn't give you like a good cardiac output going back. So this causes your blood pressure to fall as well. So your blood pressure goes down, your heart rate has gone down. Because there's not a ton of blood making it back to the heart, the cardiac output goes down, your heart rate goes down even more, which in turn moves less oxygenated blood back to your body tissues, causing your blood pressure to drop even more. So you can see how this form of shock really works. It stops the oxygenated blood from getting to the body tissues, which allows them to not perfuse properly, and it does not allow that deoxygenated blood to get back to the heart in an efficient manner, and it's all kind of this spiral. In the case like they talked about in the earlier slides, a paramedic could give a vasopressor as well as IV fluid. So the IV fluids would help to fill that area of the arteries and veins, you can see here, to help improve your blood pressure. As well, the drugs like epinephrine, norepinephrine, those vasopressors will get directly into your bloodstream and have direct effects on your circulatory system, and that would be, driving your arteries to constrict and your veins to constrict back to how they were. I erased the wrong one there, but that's fine. Which in turn causes your blood pressure to rise and causes your heart rate to increase as well. Vasopressors will also cause your heart rate to increase. So you could see, color this back in, with this graphic, even with that disruption that caused the neurogenic shock, the regression of the circulatory system and the perfusing of the body's tissues, that with prompt and proper treatment, you can stop that spiral of shock and even reverse it to bring back the appropriate heart rate and the appropriate blood pressure to continue perfusing the body's tissues. So that was just a little visual cue explaining the disease process, explaining what happens in the body when treatments are provided. Neurogenic shock presents a lot like most other forms of classic shock. There are a couple pretty key differences. The first difference being that the heart rate is actually going to drop. In most other cases of shock, not neurogenic shock like hypovolemic shock, cardiogenic shock, the heart rate is going to increase to try to compensate for the lack of perfusion happening in the body. In neurogenic shock, that signal is blocked, so it doesn't even get the cue that it should increase. So it kind of maintains that default rate, which is a low heart rate. Another big difference is that instead of the skin becoming cool, clammy, it's going to be pretty warm, and that's because of that loss of vascular tone, making the blood vessels dilate. A lot more of that blood has surface area near the skin, and it actually increases the temperature of the skin, so you'll be able to feel that it's warm. It's just important to know if you come across a person in the field, a patient who's suffering from neurogenic shock, there's certain precautions you got to take as far as spine immobilization and management of that patient, not making the situation worse for them. That definitely you might have to do with other forms of shock if it's presenting because of a trauma, but it's specifically important with neurogenic shock. And that's what we have today for our presentation. Thank you guys for watching, and we'll see you next time.